Hi Andy, this is Dr. P. Ravi Kiran, General Physician and Diabetologist at Onus Robotics Hospital, Champapet. As a part of corporate social responsibility, we have been talking about fatty liver. This is the second video in the session of fatty liver. Let's know about fatty liver. Fatty liver, the silent disease of modern India. Why should we know about fatty liver? India is becoming the diabetes capital of the world. But do you know we are quietly becoming the fatty liver capital too? One in every three individuals have been suffering from fatty liver side effects in one form or the other. Fatty liver is now affecting every one in three are urban individuals. With a population of 150 crore individuals, if one third of the population becomes affected by fatty liver, nearly 30 to 40 crores of the population would be having fatty liver and its complications. Why fat is accumulating in Indian livers? Fatty liver, which is the layman term which we have been using, is now technically called as metabolic dysfunction associated steatotic liver disease. Previously, it was called as NAFLD, non-alcoholic fatty liver disease. But as the term was doing no big justice for the condition, we have changed it to metabolic dysfunction associated steatotic liver disease. It happens secondary to consumption of excess refined carbohydrates, high insulin levels, visceral fat, sedentary work culture, and one more important thing is the genetics which we are present with. The Indian genetics are more towards storing the food than utilizing the food. Why Indians are more vulnerable? Because we have higher body fat at lower BMI. What it implies is if we are at a BMI of 24 kilos, 24, and a Western counterpart is at a BMI of 24, the fat percentage in Indian body at the BMI of 24 is far higher than the fat percentage present in the Western population. That is because our genetics are a bit on the bad side, which would make us store more fat. Thin inside, fat outside, TOFI phenotype. This is also one of the characteristic types for Indian population, where we are thin outside and fat inside, where our hands and limbs are narrow, but our visceral fat is concentrated around the abdomen. High carb diet, rice, chapati, sweets, rapid urbanization and sleep deprivation. These two are a result of rapid urbanization and software culture, where we are having more side effects. The Indian epidemic. Rising obesity in metros. Because of the sedentary lifestyle, we are having rising obesity in metros. Fatty liver in IT employees is on the sudden rise. Increasing cases in 20 to 30-year-olds and fatty liver in non-alcoholics. Many of my patients, especially teetotalers and non-alcoholics, they come to us and they complain that, sir, we don't drink alcohol, but why did I develop fatty liver? So I don't drink alcohol, I don't smoke, but I develop fatty liver. This is the most common question that I receive in my OP. Always remember, fatty liver in India is mostly metabolic and not alcohol related. That's why we have developed a new problem. Sitting is the new smoking. Carbohydrates, increased carbohydrate consumption equivalents to alcohol consumption, because these damage the body to the same extent as we are consuming alcohol and we are smoking. What is happening inside the body? Whenever we consume excess carbs, they are converted to fat in liver. Always remember, you may consume cholesterol, you may consume fats, you may consume proteins, you may consume carbohydrates, which you may consume whatever you want, but if it is in the excess quantity, the liver is forced to change it into fat, because fat is the easiest storage form. So as the fat starts getting accumulated in the body, there is insulin resistance which starts occurring. Slowly, the liver starts storing triglycerides. The inflammation starts increasing. Then the next steatosis, cirrhosis, and scarring may develop. Initially, there would be steatosis implies fat accumulation in the liver. NASH means non-alcoholic steatohepatitis, where the inflammation starts in the liver, followed by fibrosis, cirrhosis, and liver cancer. Why is fatty liver called silent? Because in 90% of the patients, there are no symptoms. By the time they develop symptoms, it's already too late. No symptoms initially. Common weight complaints in less than 10% of the population. That too includes chronic fatigue, bloating, central obesity, borderline sugars, elevated triglycerides, which are not significant when seen from only the single blood report point of view, but when they are seen as a whole from the eagle point of view, they imply fatty liver and metabolic syndrome diseases. And the bad thing is, fatty liver, diabetes, cholesterol, obesity, weight gain, PCOS, irregular menses, These all problems can be related to insulin resistance, and they are a spectrum of insulin resistance. Some may present with fatty liver, some may present with diabetes, some may present with hypertension, some may present with cholesterol problems. But in the long term, after 10 to 20 years of developing a problem, there are majority of the patients develop all the problems. That's what we see in the common people also. A patient has been a diabetic for 20 years, he inevitably develops hypertension. A patient is having cholesterol problems over the 20 years, he would inevitably become diabetic because these all are interlinked. Diagnosis in Indian settings. Sadly, the blood reports in majority of the times don't give us any major clue, but in some cases, the AST, ALT, the liver enzymes may be elevated, that too mildly, not so drastically high, sometimes within less than the two upper limits. If the normal values are 40, it may be less than 80, but elevated more than 20, 30. Gamma glutamyl transferase, lipid profile, HbA1c. These all indicate the metabolic syndrome present in the body. The easiest and the most best screening test is to get an ultrasound abdomen, which would help us identify grade 1, grade 2, and grade 3 fatty liver. Whereas fibroscan is a more specific test, which could help us grade the liver illness by the fibroscan, because fibroscan helps us know the the scarring, the toughness, and the hardness of the liver. Fatty liver and Indian metabolic syndrome. This is what I've been talking about. Always remember, diabetes, hypertension, cholesterol problems, obesity, heart diseases, PCOS, and fatty liver all are secondary to the metabolic syndrome, which occurs secondary to insulin resistance. So insulin resistance causes fatty liver and not the other way around. Fatty liver is not just a liver disease, it's a metabolic disease. The most important question and the most interesting question, is it reversible? Yes, especially early stages. There are three grades of fatty liver: grade 1, grade 2, grade 3. In grade 1, majority of the patients can attain complete reversible status, whereas in grade 2 and grade 3, there would be some permanent damage occurring in the liver. Therefore, complete reversible may not be possible, but a partial reversal can definitely happen. What works for reversal? Evidence-based targets: 5 to 10% weight reduction. If you are weighing 80 kilos, even if you lose 8 to 10 kilos of your body weight, there would be a drastical reduction in fatty liver conditions. Reduce refined carbs and sugar, increase the protein amount, definitely do strength training and walking, and sleep correction. See, always we have been multiple times telling that for a metabolic syndrome or insulin resistance to develop, there are 5 reasons: genetics, diet, lifestyle, stress, and sleep. Genetics, we can do nothing about it, but the other 4, diet, lifestyle, stress, and sleep, we can definitely control. So if you are able to control those 4, then definitely we would see good results. The timeline: once we start doing these lifestyles where we lose 10% of our body weight, where we reduce the carbohydrates, increase the resistance training, increase workouts, within 8 to 12 weeks we can see definitive improvement in our lab parameters. Within 3 to 6 months we can see ultrasound downgrade. If there is grade 3 fatty liver, it will come to grade 2, grade 2 will come to grade 1. Within for 1 year, the fibrosis will maximum move away, and which is irreversible may stabilize. Indian specific action plan. We as Indians, what should we do to prevent fatty liver? The practical advice is reduce portion size of rice and chapati. One practical advice which I give to my patients is, if you consume 1 cup cooked brown rice, make sure you consume 1 cup dal and 1 cup curd. 1 cup brown rice, 1 cup dal, 1 cup curd. That is the most easiest thing. 1 cup we includes to 250 ml of serving cup. Avoid fruit juices and sweets. Increase dal, eggs, paneer, and fish. 30 to 35 minutes of brisk walking, strength training 3 times a week, and waist circumference monitoring. Apart from weight circumference monitoring, the easiest thing you can do is weight monitoring. Go to the weighing machine, check your weight very frequently. That would help us motivate to lose the weight that we are ought to lose. Please do follow all these things and prevent yourself from becoming the next patient with fatty liver. Let's help reverse the India from the fatty liver pandemic. And this is Dr. P. Ravi Kiran. We are running diabetes reversal program and fatty liver reversal program. Please do join us to attain fatty liver reversal. Thank you.